Of recovery. Now joining us live now via Skype to talk about the diagnosis and treatment options for throat cancer is Dr. Jerome Weingarten, an oncologist and throat cancer specialist at St. Joseph Mercy Health System. Thank you so much for joining us, Dr. Weingarten.
Thank you for having me.
First of all, I want you to talk about exactly what is cancer of the throat, because we know Douglas has like a walnut-sized tumor at the back of his tongue. So is that where it normally shows up?
Yeah, cancers of the throat usually include the tongue, the voice box, or the larynx, or the tonsils. Those are the most common places.
Now, what are the risk factors for throat cancer? Because I've heard a lot of talk about smoking and drinking today.
Right. The most commonly associated things that we have that are associated with head and neck cancers are tobacco and alcohol. And actually, the combination of the two together is additive. So if you do both, you're at a higher risk for both of those, for having that. There's another risk. The risk of being associated with a virus called HPV has also been more known lately, and is also a common risk factor.
Now, how do you treat throat cancer? We know Michael Douglas said he's already being treated with, I think, chemotherapy.
Right. So the standard approach is to go ahead with chemotherapy and radiation together in an attempt to preserve the organs that are involved. Surgery is used after they finish their therapy to help treat smaller areas that may be left behind after the initial treatment.
Now, Michael Douglas has fourth stage throat cancer. So what are recovery options like?
Well, actually, stage 4 head and neck cancer or throat cancer is a little bit different than stage 4, for instance, lung cancer. It means that the tumor is more localized to the neck in head and neck cancers versus in other tumors. And so his prognosis is actually a lot better than somebody who has stage 4, for instance, lung cancer.
Wow. So the bottom line tonight, if you're drinking and smoking, you need to stop right away. And how do you know? I mean, he said he had a sore throat and they still didn't diagnose it. I mean, anything we should be looking out for?
Well, it's a very common scenario that I hear often, and what I would suggest to people is that finding it early is better. If you have a sore throat that's persistent, even after receiving antibiotics for an infection, if it's still there, I think it's time to go back to your doctor and maybe even see a specialist.
Okay, stay on top of it. All right, Dr. Jerome Weingarten from St. Joseph Mercy Health System, thank you so much for joining us tonight.
Thank you for having me.